me great pleasure to welcome Dr. Gualberto Díaz-Saez from Spain, who's going to be talking about a homeopathic medication that can improve upper respiratory tract infections in COPD patients. Thank you.
Good morning, everybody. Thank you to HRI, thank you to the speakers, thanks to all the participants. Please do not read that because that's a spoiler. So now that you didn't read it, let's build up the story, which is homeopathy and upper respiratory tract infections. Everybody knows it works, and everybody knows that it's a real problem of public health. And everybody knows it works from the experience, but also from robust evidence coming even from studies that are trying to criticize homeopathy, as the SANG study did. But there's a world beyond RCTs, as Claire told us yesterday, and we should go to observational studies also and cohort studies that can reflect better how homeopathy works. And well, this is not a meta-analysis, it's just an approximation to know what we were talking about. And actually Lind was quite fond of it when I presented it in Berlin, but just to say that if we take only cohort studies in upper respiratory tract infections, we find that they are mostly effective and that they mostly reduce the use of antibiotics and other conventional drugs. And if we take the latest studies, I'm going to just talk about two of them. This is the EPI3 cohort studies in France, and it shows how the homeopathic management reduces the antibiotic consumption and anti-inflammatory consumption in the patients. And if we go to this another one, it's a retrospective study showing how the use of homeopathic medicine, in this case it was oscillococcinum, would reduce the number of respiratory tract infections in children and adults that were coming to a monographic consultancy of a pneumologist in Italy. There are more studies about oscillococcinum, and here's the issue. At the time, and I am disclosing a conflict of interest, I was working for Wagon Laboratories, and I was a little bit disappointed because everybody knows oscillococcinum, and everybody knows that it works. And everybody knows that, well, not everybody knows that it works. A lot of people have a good experience of that, and it's very widely used all over. So, but I was not very happy because I thought that we should be working in things that are really relevant to the medical consultancy. And at the time, I met a pneumologist that was using a little bit of homeopathy here and there because of a common friend. And we met, and I attended to one of his conferences, and he was talking of how the origin of the COPD, chronic obstructive pulmonary disease patients, were suffering from exacerbations, mostly from viral infections. And I had the impression that aggravations were mostly bacterian. But he explained how it's the same bacterian because we found that in the sputum, but in fact, those bacteria are always there, and the cause of the aggravation is viral. So knowing that, we thought that we could go further, and we could do a study showing if, in fact, helping the body face the viral infections and having less viral infections would lessen the number of exacerbations in COPD patients. So that's what we did. COPD is relevant to our consultancies. It's relevant to public health. And knowing that viral etiology is higher than we thought before, then we got a hypothesis, which is a drug such as a homeopathic drug such as oscillococcinum. Is it still effective in COPD patients? And does it actually improve the management of COPD by reducing the number of exacerbations? So we were very lucky to get the interest of ACINAR, which is an association of research in respiratory system that it comes from a little village in the north of Spain, in a little city, but it actually makes studies all over. And Dr. Garcia Rivero, who's the pneumologist and the president of the association, he travels all around the world giving conferences and doing research for every kind of institution, including conventional laboratories. So we were very happy to count on them, and that helped us recruit a lot of practitioners. And some of them would use homeopathy, but some others didn't at all. They didn't know homeopathy. And this happened about 2013, and I remember writing a draft of a protocol in a napkin in a restaurant, talking with a pneumologist and doing a plan on how he should try with some of his patients first during some months to see what happens and see if they are satisfied, and then we could keep on going. So that's what we did, and we got the approval of ethics committee and all the stuff. We developed the study in the winter time, autumn-winter time of 2015, 2016, and we got to publish it. And I think that, and we published it in Respiratory Medicine Journal, which is a quite interesting journal for respiratory system, very good impact factor, and well, I will give a clue about that afterwards. So we measured frequency and duration of the upper respiratory tract infections and also of exacerbations. Of course, we also measured consumption of conventional drugs. It is an observational study, and I liked it observational, but true that we couldn't do otherwise because the authorities wouldn't let, Spain is pretty hard for homeopathy, and the authorities wouldn't let the doctors challenge the patients with a homeopathic medicine. So we had to do it the observational way, like the patient was taking or not voluntarily the drug, and then he would be enrolled in the study. So the patient would be not randomized but assigned to one of two groups, receiving or not the homeopathic treatment. And we got 219 patients, with not many withdrawals, just 8 withdrawals. And we would follow them for 2 visits, separated more or less 2 months, which is the normal care, the usual care. That's a limitation because studies in COPD normally should last between 1 and 2 years. But this was kind of pilot study to see what would happen and to see if it was really interesting to start thinking of this approach. And the results were that the populations were comparable. And they were comparable from the socio-demographic point of view, but also from the clinical point of view. And as you can see, time for diagnosis, spirometry, grade of dyspnea, number of people in each phenotype class. And this is it. The main goal was to know if the homeopathic treatment also worked in COPD patients, and it looks like it works. And it might seem that the reduction in the duration of episodes and the duration and the number of episodes is not so much, but actually it is. If we compare it to other studies in COPD patients, that's a lot. And it's a lot even more if we take into account that the difference has been achieved in only 4 to 5 months' time. If it was longer, then we would have an absolute higher result. And this is maybe a better way of seeing it because minus a half is not very explanatory, but this is. How many people would suffer from 2 or more infections? Well, 3 more times a risk of infection, of suffering 2 or more infections in the non-homeopathic group. So it's relevant. There's a lot of people who are not suffering from 2 or more infections or from 3 or more infections. And does it have an impact in the exacerbations of COPD patients? Well, it does not, the tendency is not statistically significant for the whole group, but if we take the group that actually worries us, which is the group of exacerbators, then it is. Then we got less aggravations in patients suffering from COPD and taking the homeopathic treatment. And yes, it was linked to a decrease in the number of, in the amount of corticoids taken for aggravations. And the quality of life didn't change much because you don't expect it to change in such a short, in 4 to 5 months' time. There were not many adverse reactions, not more in the treatment group than in the control group. So I conclude that there was a decrease in the number of upper respiratory tract infections, that it leads to a decrease in the number of exacerbations in the exacerbator phenotype patients. It decreases the use of corticoids, and there are not more adverse events because of the administration of the homeopathic treatment. So I would still say that this is relevant also because this is an exportable option for people who don't know homeopathy. And I think that it is a way that people, that our colleagues, get to know homeopathy in a relevant way. Like, it's not just treating flu, it's treating COPD patients so that they are less aggravated, knowing that each aggravation leads to a deterioration of the lung function. So it's relevant, and if we get a lot of doctors seeing how with a very simple measure we can get results in our patients, then we think that it's easier to convince them that with an individualized approach we could get even better results, as we know from our clinical experience every day. And also there's another lesson to learn, which is it takes a lot of time to do a study, and it takes a lot of time to publish. It was 50 people involved in this study, 50 people, quite a lot of money also. And it started in 2013, and we are publishing it right now. And we were rejected 3 times, and one of the times it was justified by some issues that we were able to give answer to. Like we made changes to this, that you have to be humble and you have to pay attention to what the reviewers tell you, because you can improve the way you are saying things or the way you are analyzing data. And we also had rejections because of nothing, as we have seen here with some of the people that have presented. But surprisingly, we tried a journal and it didn't happen, another journal it didn't happen. When we tried the one that we had never dreamed to accept the journal, the paper, it was the one who accepted. So sometimes you have to be ambitious and you have to try again and again, and you have to be humble and accept the advices that the journals are giving to you on one hand, and also accept that you shouldn't sometimes be so you shouldn't broadcast your results with such an enthusiasm as we sometimes do, and you have to be humble and say, there could be a possibility that this could help, blah, 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 blah. It's prudent, it's useful, and actually it's more ethical and more rigorous. So that's it, thank you.
Brilliant.